Good evening, all. I'm Lamba coming to you from our studio here in New York City. This is Wednesday night's Vision of Asia. Welcome to our daily South Asian news segment, presenting to you the South Asian American voice. Here is what is happening all across, from protests to the coronavirus pandemic impact. Today, the world surpassed more than 8.1 million cases of the novel coronavirus, with at least 444,000 deaths globally. Quite a sobering number. In the United States, there are more than 2.1 million cases of COVID-19. The states of Texas and Florida are currently seeing some of their highest recorded cases, with several states presenting an increase in number of cases, with reopening taking place across the nation. Here in New York, though, we are seeing a decline in number of hospitalizations. According to Governor Andrew Cuomo, New York, which was once the epicenter for coronavirus infections, has now the lowest rate of the virus spread. We again urge all our viewers to continue practicing social distancing here and wear masks in public. We are still going through this pandemic, and there is a warning of a second surge of cases. So stay safe and protect yourself as well as others around you by taking safe hygienic measures as well as following the guidelines of the CDC. We have tonight much on the impact of COVID-19 and its updates, featuring top South Asian medical professionals, along with our report on nationwide anti-racist protests and demonstrations for racial justice and end to systemic oppression following the death of George Floyd. President Donald Trump has signed an executive order on police reform, and the Democrats and Republicans in Congress are now also working on reform plans. Facebook removed hundreds of accounts which were promoting hate or racism from far right-wing organizations. And people have been tearing down controversial statues and monuments across in response to racial inequality seen in states such as Alabama, California, New Mexico, Minnesota, and Virginia. This and more comments tonight on the needed change in system being advocated by many, along with the take on the rise in domestic violence during COVID-19. Here are the headlines. Dr. Anuj Vohra addresses South Asian community on COVID-19 updates, measures in Connecticut. Navneet Bhalla on rise in domestic abuse during COVID-19, Manavi, New Jersey. Lakshmi Sridaran on George Floyd, police brutality and anti-blackness, SAALT. Time for a short break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Lamba, and this is Vision of Asia. Beginning the episode, we are presenting more perspectives on the case of George Floyd and nationwide anti-racist protests which are calling to defund police departments and an end to systemic oppression. We spoke with Lakshmi Sridaran from SAALT, South Asian Americans Leading Together, to get answers on the issue of systemic racism, anti-blackness, and its connection with police brutality in America. SAALT is a national nonprofit that fights for racial justice and advocates for the civil rights of all South Asians in the United States, with this vision of finding full dignity and full inclusion for all. One of the largest advocacy programs for South Asians, SAALT's work includes public policy, building partnership, and mobilizing communities to take action. Lakshmi here called for leadership for police reform while reflecting on steps our community can take to be an ally of the Black American community. She also urged all viewers to exercise their right to vote and to get their voices heard. Here is Lakshmi Sridaran.
Yeah, so I think, there has been the Justice in Policing Act of 2020 that was introduced in Congress. And I think, once again, that sort of goes again along the analysis that, there are a few bad cops in the system. And here are ways that we can tweak and reform the system for it to work better for people. And I think that what these demonstrations across the country are showing is that reforms do not work. I think the defund the police strategy is a really important one that the movement for Black Lives has been talking about for a very long time in one of their core pillars, which is to divest in police and to invest in communities. And I think that really is the key. And I worked in New Orleans after Hurricane Katrina, and one of the tools that we used was participatory budgeting. And what that really did was think about, look at how much money is being spent on expanding the jail and funding the police state here in New Orleans, which incarcerates more people than anywhere in the US. And what can we do if we really understand the city budget? How can we take the money out of policing and actually invest it in resources for our communities? And that's the conversation that I think is happening at the national level right now around abolition and defunding the police. And I think there are some really, I think, very well thought out tactics. I think 8 to Abolition is a really powerful campaign that has come out that really lists what are the reforms that we can make that actually lead to defunding and abolishing the police. So I think these are some of the things that we really need to be following.
But this is a change in the core system that we're talking about, right? It's not a one-day change. It's not a small, little, bill that's passed. We're talking about a full reform, if I'm understanding you right.
Yeah, we're talking about a full transformation of the system, and I wouldn't even, I wouldn't even call it reform, because then that means that there's some legitimacy still left in the system that can be, tweaked or moved to make it better. And I think what people are calling for is like total transformation, and I really think that that's what we need right now.
Lakshmi, there has been a pushback from the other side against these protests in which they're claiming all lives matter. There has been a push for why these protests are happening, why just only Black Lives Matter. I would just like for you to give a response back to that if possible.
Yeah, I think this all lives matter framing is really, really problematic. I think it's really important to understand that the Black Lives Matter hashtag was created, and the campaign and all of the work that went behind it was created to show that all lives, yes, should matter, but they don't. And it's been very clear in this country that Black lives do not matter for so long. And I think that is the whole point of it, is that all lives do not matter. And we have seen that over and over again, that is not how Black communities are treated. And so I think it's important to understand, why that particular campaign emerged and why that language. It's critical that we see that, and to sort of whitewash or brownwash it with this idea of all lives matter as a counter to that narrative is really problematic, and it really erases the reason that campaign was created.
Lakshmi, if I was to ask you, because a lot of our viewers are South Asians watching us on ITV Gold, how should they sort of get involved without getting in the way of the movement or the message, to ensure that, exactly who we're talking about get accounted for, and there's a conversation on that? How should we engage?
Yeah, I think that's a great question. I think it's really important right now as a community to figure out how we step up without centering ourselves in this moment. And I think that a lot of that is having those difficult conversations within our family. We've shared a lot of resources from other organizations that I mentioned earlier. I should also mention South Asians for Black Lives has put out a lot of different resources and ways to get involved. I think educating ourselves on what it really means when folks are talking about abolition, defunding the police, and not taxing our Black friends or Black community members to continue to explain things to us, but to really get out there and do some research on these really important conversations that are happening, and to do the work within our own family, within our religious institutions and our communities. I think these are the ways that we can not center ourselves, but be supportive of the conversation that is happening right now that should always continue to center Black communities.
Lakshmi, how important do you think the elections are going to play a role in right here to make sure that all minority communities are accounted for? We have somebody that we can rely on and somebody that can be advocated for. Currently, we're looking at primaries across the nation. We have elections coming in November. I know there's a lot that's been discussed in that sense. What are your comments on it?
Yeah, I do think the elections are important, but I think, voting is always, usually the very last step that we take, right, to select somebody to get into office. But there's so much organizing and building power in our communities that needs to happen before a ballot is cast. And so, unfortunately, I think between the two parties that we have in place right now, I don't necessarily think that we see a place for the kind of transformation that people are calling for right now. And so while I do think it's important to get out there and vote, and especially to push back against a lot of the efforts that are in place right now to repress the vote, to limit the possibilities for people to vote electronically and to vote by mail, and absentee, you know, those are the types of efforts that we need to be combating right now, because it is important that people exercise the right to vote. But I also do think that, you know, legislative change and elections are such a very minor part of the kind of change that we really need to see right now.
Now we have another segment of our conversation with the Executive Director of Manavi, Navneet Bhalla, on the rise in domestic abuse during the coronavirus pandemic. Manavi is dedicated to serving the unmet needs of South Asians affected by violence, with its mission to end all forms of violence against women and break the cycle of power and control that many survivors face. Manavi adheres to the empowerment model of advocacy and stands in solidarity for liberation of women who have suffered through violence. Discussing various attributes now and instances that are leading to an increase in domestic violence, Navneet reflected upon several resources which are available through Manavi for survivors currently. Even without a global pandemic, victims of domestic abuse are facing many barriers to seeking help and assistance, and hence Navneet Bhalla urged all to support domestic violence agencies that are working during this pandemic to ensure survivors stay safe and healthy and can reach out for help. Here is Navneet Bhalla.
Like most agencies right now, domestic violence agencies, some of the, I think initially we really had to kind of think about ways that where we can bring all our services and support online and remote. So even though initially we had a few challenges, I think over time what we have done is, like I said, the 24-hour hotline we've always had, and that has been huge for us. But for example, support groups, they used to be in person, but now we do the support groups virtually. So we offer virtual support groups, and we have seen great response, and survivors have given us great feedback that has been something that has really been meaningful to them. At the same time, legal clinics, we've been doing them over the phone, which we did before, but now more so in a more enhanced way. We are keeping more in contact with our survivors virtually and remotely, even with our residents at Ashiana. We keep a regular check. And like I said earlier, some of the biggest challenges, I think, funding is an ongoing challenge. And I want to mention this specifically because, like many agencies, we have a portion of state funding or government funding, but then we all also rely on funding from our communities. And every year, Manavi has an annual fundraising gala, much like all the other sister agencies, culturally specific agencies that I know of. So I think this is something I want to say on behalf of all our sister agencies, for anyone that's listening, that most agencies, if not all of them, I think, have not had the benefit of that fundraising from the galas that we used to do. So there has definitely been a dip there. And anyone listening, the one way that we absolutely value and appreciate the support from the community is through fundraising. And if you're able to provide funding during this critical time to the survivors and agencies, it would go a long way.
Navneet, there could be somebody that's watching you right now and could be facing some struggles of their own and could be needing help. I would love for you to give out a word of encouragement or perhaps advice to people that are suffering in silence right now, especially in this pandemic. What should they do according to you? Who should they reach out to? And how should they take care of themselves?
So the first thing I want to say very clearly to you is that you are not alone. Please know you're not alone. We are here to support you. In addition to Manavi being here to support you across the state in New Jersey and across the country, there are a whole range of sister agencies that are out here with us to support you. We also have a 24-hour hotline. So if it's difficult for you to call us during the regular hours, you can call us any time during the 24-hour period, whether it's a weekend, late at night, and we've had those calls. And our hotline number is 732-435-1234. 1414. Also, you can reach out by emailing us at manavi@manavi.org. We've also had survivors reach out to us via Instagram, via Facebook. So you have all those tools to reach out to us at the same time, and our support groups are open to you that you can participate in. One other thing I will say, something called safety planning, and that's really important. If you're a survivor and if you're in an abusive relationship, if you're experiencing or you think you are under imminent danger, of course, in that situation, we advise you to call 911. But if it's not imminent danger and there's a pattern of abuse, we do recommend and advise you to think about safety planning. Now, what does that look like? Essentially, what it means is you have an emergency bag where you have all your important documentation. This could be your immigration documents, this could be your kid's birth certificate, health insurance, bank statements, all these documents, or take pictures if your phone's not being monitored. But having all this documentation in case you ever have to exit or leave, having a phone where you can pay as you go, having some cash at hand, and also some practical tips that we always give. I know that it's not safe to be in your home right now if you're in an abusive relationship, but thinking about how to minimize the danger by thinking of a space in your home that may be more safe, meaning thinking about being in a space when you think the abuse may escalate, if you have children especially, to be in a space where there's no objects that can be thrown around, there's no glass, there's no things that can be used as a tool. And also if you have a vehicle or a car, thinking about where you can exit easily out of the house and having an exit in your house. And finally, having a friend or a neighbor that you trust, who you can either speak in some kind of code word or code language. We've had situations where survivors have been able to alert a neighbor or a friend by using some kind of code word where they know they're in danger and the neighbor or friend can call the police for them, or even training their children to do that. So you have some safe mode of communication and a support system.
It's time for another show break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. This is Vision of Asia, Voice of the Community, and I am Aditi Lamba. Looking now at the coronavirus pandemic in the UK, a new study suggests a widely available steroid drug may treat the sickest COVID-19 patients. Today, the United States surpassed 2.1 million COVID-19 cases with 117,000 deaths as the nation reopens. States Florida, Texas, Arizona set the daily records for new COVID-19 cases. New York City is headed towards its phase 2 of reopening, which allows for a wider range of businesses to continue to reopen under current COVID-19 guidelines, including retail businesses, offices, and restaurants to be open for outdoor seating. This is happening while top health officials have warned of a second wave of the coronavirus in the fall. So where does that bring us, and how should we process these numbers and cases and deaths? Expert in emergency medicine, Dr. Anuj Vohra spoke with us earlier today, discussing much on the impact, measures, and updates on COVID-19. Discussing reopening and its implications, Dr. Anuj Vohra urged all to still practice social distancing and wear masks, and also gave his comments on his frontline experience and the healthcare system. Here is Dr. Anuj Vohra.
So these numbers are scary when you hear about such high volumes. You know, worldwide, we're talking about over 5 million people that have been affected by COVID. And what happened? Well, the whole world shut down essentially. And little by little, we're seeing an attempt to return to normalcy. So as things open, as slowly or quickly as it may be in certain areas, we are still going to see a rise in the amount of COVID patients that we see. Now, take my area. We're in Connecticut. I'm the Director of Emergency Services for 2 emergency departments. And we had about a week being almost COVID-free. And now we're starting to see a little rise again. Why? Well, we're in phase 2 of our reopening. So as people are out and about, they're exposed to any kind of illness, especially that what we're talking about today being COVID. So it's important that people understand that despite things opening in your area, whether they have or haven't yet, You still need to keep your distance from other people. You still need to wear face masks in public. You still have to wash your hands. And you have to still take all the measures required to maintain your safety.
Did you ever predict us to have such high number of deaths in the country? And I'm just trying to ask you this question, understanding that we are now predicting even more since the country is reopening. Did you, since you are in the ER and you've had firsthand experience with this, did you predict it would be this bad?
No, I think most people would agree that no one could have predicted this illness being as severe and devastating as it's been worldwide. And we haven't seen an illness like this in 100 years. When you think about, people always ask me, well, we've never seen anything like in human existence. We actually have. The initial flu, the Spanish flu, in the early 1900s had more cases and more deaths. But what's made us more successful in our ability to reduce as many mortalities as the Spanish flu is the ability to communicate, our technology, because never in our lifetime have we seen a global strategy to try and defeat something for essentially the good of mankind. So the whole world, from the United States to India to everywhere you can think of, has made some strategy to try and introduce high-level safety measures to protect their population. When we started first hearing about COVID, our first cases were November, December, January, and it really just blew up in March. Could anyone have predicted it being this severe? No, because if you did, we would have been more aggressive on a global scale of shutting things down earlier and protecting our population.
So in understanding this virus itself, Dr. Vohra, could you give us some updates into, what is it that it's doing, that the impact continues to be so massive? And, when you are practicing right now and you're treating COVID-19 patients, what are some of the uncertainties or challenges that you're facing in terms of patient care or in terms of just treating COVID itself?
Well, the first challenge is just the personal protective equipment. Some people have it, some people don't. New York City has been devastatingly affected by the lack of personal protective equipment, and they are getting reinforcements and have gotten reinforcements, but that was one. I mean, imagine coming to work knowing that you could be exposed to a deadly illness and not having the appropriate gear to protect yourself and hence protect your family and loved ones. That was part one. Now, most places have the appropriate amount of PPE, but it's exhausting to put it on every time you go into a patient room. What does that mean? I'm putting on a face mask, maybe an N95 under that, another face shield on top of that, a gown, gloves, all of this every time you go and see a patient. And if you're talking about a long, busy shift, it gets pretty exhausting. And we're seeing sometimes some people lax in this PPE to make sure that they're protecting themselves. So that's one area of burnout and concern, but all we can do is continue to educate and recognize that although these patients are not coming in with COVID as often anymore, that potential is still there. Because it could be anyone with a cough, shortness of breath, flu-like symptoms, runny nose, cough, congestion, even abdominal cramping, diarrhea, and vomiting. So there's so many presenting symptoms that's impossible to truly say, oh no, that's not COVID related, because so much is.
What are some of your biggest concerns with reopening? We're looking at phase 2 of reopening in many areas of the country. Some are moving even ahead. We're seeing at least 21 states that are on an increase of COVID-19 cases. Where do we stand in this reopening, and what is its true impact on COVID-19?
I think it's necessary to reopen. I think we all are tired of being stuck indoors, and I totally get that, including someone that has 4 small children. We need to be outside. But I think what's important to remember is, even though things are reopening, that's not to say we're just going to go back to the way things were and have huge gatherings in the streets and not maintain our safety measures that still need to be implemented, keeping your distance from people, wearing your face masks in public, things of that nature. So I think I would say personally, I'm pro reopening, but with the understanding that people individually have to take their own health and safety measures into account. It's not just going back to the way things were, it's opening slowly so that we can realize that things have to be different going forward, and they will be different for the rest of the year.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com, or you can also follow us on Facebook at itvgold. Remember, you can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.